Hi, I'm Stephanie Apt. I'm a licensed Medicare consultant and the founder of the Apt Insurance Agency. And I help seniors all across the country to navigate the world of Medicare. So right now we're in November, filming this video in the middle of November. We're smack dab in the middle of the Medicare annual election period, which happens every fall. And during this time of year, you're going to hear a lot more about Medicare. There will be advertisements you'll be seeing on TV, hearing advertisements on the radio, probably receiving information in the mail. And a lot of these advertisements have to do with these all-in-one Medicare plans. And some of them say they include dental and vision benefits. So what are these all-in-one Medicare plans and how do they compare to original Medicare? That's what we're going to talk about today. Just do a really brief overview of these all-in-one Medicare plans. So there are two main parts to original Medicare, Part A and Part B, and that'll be right there on your red, white, and blue Medicare card. Part A, which is your hospital coverage, is usually free as long as you've been working in the United States for 10 years. Part B, which is your doctor or your medical coverage, most people pay a monthly premium for. So most people pay a standard monthly premium of $134 per month is the standard premium in 2017 to be on Medicare Part B. Now, once you have Medicare Part A and Part B, you have two main choices on how you can get your coverage. So the first choice, or option one, is to keep your original Medicare benefits, Part A and B, that you're receiving through the government. And then from there, add on a Medicare Part D drug plan, which will cover your prescription medications. And then most people add on a Medicare supplement or a Medigap plan. And those plans are designed to work right along with your original Medicare benefits of Part A and B and pay the gaps. So those Medigap plans or Medicare supplement plans pay the deductibles and co-insurance that original Medicare doesn't pay. So this first option that you have, this first path, allows you a lot of freedom, right? Because you're going with original Medicare, so you have the freedom to pick your own doctors and hospitals. And usually you pay very little to nothing at the doctor or hospital because the Medigap or Medicare supplement plans are designed to fill in the gaps. They pay the deductibles, the co-insurance, so that you're responsible for very little out of pocket if you do get sick, if you go to the doctor, if you go to the hospital. Now, the other option, or option number two, is to go with a Medicare Advantage plan. And Medicare Advantage plans are also known as Medicare Part C, and these are the all-in-one Medicare plans that you're hearing about. So, what is a Medicare Advantage plan? Well, it's important to know that Medicare Advantage plans are not original Medicare. So while you still will be paying your Medicare Part B premium, you're going to have to pay that no matter what option you choose, right? You're going to still be paying that $134 standard Part B premium. Medicare Advantage plans are managed healthcare plans administered by private insurance companies. So if you choose to do a Medicare Advantage plan, you're now receiving the benefits of Medicare Part A and B through a managed healthcare plan administered by, Humana or United Healthcare, whatever insurance company you're deciding to go with. So Medicare Advantage plans work a little bit differently. With a Medicare Advantage plan, you typically have more limitations on the doctors and the hospitals that you can use. With some plans, you're going to need referrals to see a specialist. Usually the plans don't travel with you, so there is going to be more limitations there. Also, you'll generally pay more out of pocket if you use the plan. Most plans have deductibles, co-pays, co-insurance, and usually the finish line there, the out-of-pocket maximum is between $5,000 and $7,000 annually that you would be responsible for. Now, the upside of these plans are that they are low cost. Some of them are, free or $0 a month. And then they, go up from there depending on the type of plan that you choose. And usually your drug coverage is included right there in the plan. So that's some of the benefits of doing one of these all-in-one Medicare Advantage plans. The downsides are going to be, more limitations on doctors and hospitals, plan not traveling with you, and paying more out of pocket if you do get sick or use the plan. So in a nutshell, those are some of the differences between Medicare Supplement and all-in-one Medicare Advantage plans. And it's just important to know the ins and outs of both options so that you can make the best decision for yourself, for your lifestyle, and for your budget. And if you ever have any questions, I'd be more than happy to help. You can feel free to shoot me an email or give me a call. Thanks so much for watching, and we'll see you soon.